Now we have the opportunity for each of you to make a closing remark or so. I'd like to ask Kizzmekia to lead off. And if there's anything you'd like to say to kind of wrap up your part of this, and then we'll go around to the other panelists.
The main thing that I like to lead these conversations by saying is to remind everyone that we are not, as was said earlier, out of the woods yet. And getting out of the woods is going to take a very thoughtful and universal/global approach. And it is going to not just be the burden of us on this side of the research and the science and the epidemiology of it all, but also from the people. And so, and then also to leave people with the resources that they need. So vaccines.gov is constantly updating with all the information that you need around the vaccines, whether it be boosters or children, and to make sure that you follow each of us on your social media channels to keep updated with all of the things, our opinions and otherwise around this pandemic. And yeah, to have a safe and fruitful holiday.
All right. I can get on board with that. Rick, what do you have to say to us?
I'll keep it brief. I think I just would like to reemphasize what everybody has said, which is there's so many reasons why we want vaccines and medications to be distributed equitably across the globe and not just in a few privileged countries. The reasons can be self-centered, they could be humanitarian, they could be ethical, or whatever you want to think about it. There's so much justification, and there should be no resistance to this. Resistance in this case is truly sort of shooting ourselves in the foot or elsewhere. And it's a shame that we're experiencing this again. And I hope that forums such as this one and all the other communications that people are doing are going to make people realize that we have to do better, not only for ourselves, but really because it is completely unfair that the accident of somebody's birth determines whether or not they will die of COVID or other horrible diseases.
Bill, what might you tell us?
Absolutely. Preach, Rick. And I echo Kizzmekia as well. Yes, you can follow us on our social media channels. I warn you, though, that I may interrupt mine sometimes to talk about Arsenal Football Club from my North London roots. But I want to say that there can be a certain amount of anxiety, fear, and even fatalism around this. I would like to dispel that. There are lots of things that you can do. The most important thing is getting vaccinated. There's all sorts of other low-lift interventions that you can take. To be honest, wearing a mask in the grocery store isn't that big a deal. And if we put these things in place, the rapid tests, like Rick was saying, they hand them out on the beach or on trains in the UK. So people are able to keep track of their own infectiousness. And if they are infectious, have that information. Knowledge is power. And then I just want to hand over I want to close by commenting that it's so true that these are things that we're talking about locally, but there is a world out there. And Delta is doing horrible things to that world. And we should be doing everything we can to help it.
Thank you, Bill. And Amir, finally, what would you like to tell us?
I'm just so honored to be with you all and with this great group. And I second and third and fourth everything that's been said thus far. We've seen in past infectious diseases, tuberculosis used to affect everybody in the United States. We used to have malaria in the United States. HIV was in the headlines day in and day out in the 1980s. And then when we get out of the woods, it really depends on who we or who us is, because those diseases, those infections still run rampant, but in select communities, in racially ethnic minorities, in low and middle income countries around the world. And so our eyes really should be asking who are we? And if we're in a global community, then we can't leave any of these people out of our safety net.
Thanks. Thank you very much, Amir. And I'd like to thank all the panelists once again for what was a great discussion today. I hope that the audience found it as useful as I did. This event has been jointly presented by the Forum at the Harvard T.H. Chan School of Public Health and NPR. And thank you to the Cone family for making this particular event possible. We'd like to thank you, all of you who watched and for those of you who sent us questions. We weren't able to get to all of them, but we tried. So thanks very much and have a great day.